So I'd like to introduce Ben Gales as our next speaker. He's going to be talking about using data to help us ask the right questions. Which I think was in a funny way aligned to what Andrew was saying. So Ben is currently the Executive Director of and Strategic Coordination at the Department of Premiers and Cabinet. He's got a wealth of experience in economic and social policy, and his current role, he's responsible for the strategic coordination, where his focus is on driving improved social outcomes for people in New South Wales. So without further ado, I'll hand it to Ben.
Sally, thank you for the intro. So yes, I currently work in Premier and Cabinet, so I've got a background in public policy, but also I previously was in private equity and venture capital. So a kind of background in social policy as well as investments. And so I just want to talk through some case studies of how I've tried to apply some of that kind of use of data to inform what we've done in the social sector side here in New South Wales Government. So I just want to talk through a couple of case studies of some impact investments that we worked on. So social impact investments are where private investors put up the capital up front, and the government pays against outcomes once they're achieved. And the idea there is the uncertainty is, will we get the deliver the outcomes we expect to get, and uncertainty over the efficacy of the programs. And I just want to talk through how data has massively helped us understand and drive improvements in performance, but also help us ask some of the questions where we think things have been working extraordinarily well. And we find that those kind of gut feelings, gut instinct haven't quite been as effective as we thought. And then finally, I just want to talk through how we can use data to try and cut through in extraordinarily complex situations, such as the current COVID environment, how we use data to help drive the right questions to inform decisions. So let me just kick off with the first social impact investment we did in New South Wales, which was the NEWPIN program. And what I've got here is a quick program logic in terms of what NEWPIN was trying to achieve. I'm not going to run through the program logic, but it's more to illustrate that a program like NEWPIN, which was around taking kids that were involved, kids and families that were involved in the child protection system, and trying to get those families to operate more functionally through peer learning. So the hypothesis was that actually people learn much more from and much better from their peers, rather than from, say, a social worker or a bureaucrat saying this is how you should operate as a family. So these centres were developed, which brought families together. And we thought about this across kind of 4 cohorts of families. So one was the cohort of families where we really wanted to achieve the outcome. And the outcome, by the way, sorry, I should have introduced, the outcome was, how do you restore kids who have been removed from their birth parent or parents back to their birth parents? So they've been removed, they're put in foster care, but actually the evidence is if you can put them in a nurturing, safe environment, they're better off with their birth parents rather than being in foster care. So that's the ultimate goal. And one cohort of families at the centre were where their child had been removed. The second cohort was children that were at risk of being removed. A third cohort was just where there were some early signs of dysfunction. And a fourth cohort was just actually families that were functioning fine, and they were part of that kind of peer learning. So often they were families that have been through this journey and have successfully come out the other side. So that's the context for the program. And in New South Wales Government, and this was back in 2011, 2012, there wasn't a natural funding source for the NEWPIN program, partly because that was actually quite a diverse set of families they were working with. So we looked at the program logic, and we worked out a number of indicators that might be used to understand the efficacy of the program. But it didn't fall into an actual funding pot. So we constructed it as a social impact investment. And rather than using multiple indicators, we used a single indicator, and the single indicator being the effectiveness of restorations. And you'll see from the slide the outcome after the event. So we were getting, and we have been getting, over 60% restoration rates versus a restoration rate in business as usual of more around the 20%. But the key thing here, and the reason why the data was so valuable, was the program was operating very effectively, or was believed to be operating very effectively, and before we kicked this off as a social impact investment. But what had been done today, or to that day, had very much been around almost like a gut instinct of how it was operating. And there were a number of things that the NEWPIN centres were adamant were absolutely essential. One of which being that across those four cohorts that I talked about earlier, that you needed equal representation across those four cohorts in order for the centre to operate effectively. So roughly 25% across each one. So then we overlaid a social impact investment framework. We had the intervention group, which were the families going through the cohort. We had a control group, a matched control group, so we could look at the effectiveness versus families with the equivalent characteristics but not benefiting from the centres. And then we looked at what were the results. And fairly soon after starting, firstly the program started and it was the early indicators that it was operating very effectively, but it was really interesting targeting that single outcome of restorations. So the centres started playing with what was the ratio of families that actually could go through the centre. So if we were primarily basing performance on that single cohort, that cohort one that I talked about earlier, they started playing with, well, can we put more families through that more families in that cohort through the centres? And it soon went from being that balance of 25 to 25, 25, 25% across the four cohorts. It evolved into 50% in cohort one, which was really the outcome we were targeting, and lower proportions in the other cohorts. And the point of that long-winded description around NEWPIN and why it was so effective is by putting data against the outcome, and it was an intermediate outcome that we were trying to target, that restoration, we massively drove up the performance. Sorry, the centres massively, and Uniting Care, which ran the centres, massively drove up the performance of that service delivery. And in the absence of putting that data overlay on this and rigorously looking at a control group, intervention group, we never would have driven that performance so hard. So that's my first case study of you go from a situation where a lot of this was, we think this is operating very well, the gut instinct, it is operating very well, overlaying data and overlaying a very clear intervention group, control group to understand the efficacy, and that kind of continuous improvement. And after 3-4 years, actually the way the centres were operating were very different to the way they were operating at the beginning. And it was only through that data overlay that we would have achieved that. So that's my first case study of the power of data in these complex situations. And human beings are complex, which is why these things are difficult. Now, if I can move on to a second example, this was another social impact investment called On Track. And this was about providing support for parolees as they leave prison. I forget the precise stats on this, but the 3 months after a parolee leaves prison, they are 2.5 times more likely to reoffend than they are in the subsequent 3 months. So there's this very critical period post-release where if you can support the individual to reintegrate into the community, then the hypothesis was we will reduce reoffending. So On Track was an intensive post-release program. And again, as we did with NEWPIN, we set this up with an intervention group and a control group, a matched control group. The measurement framework here, you know, and again, like NEWPIN, and I probably should have said this, whilst restoration is the outcome measure we were using on NEWPIN, what you actually want to see is a child that is thriving, brought up in a nurturing environment, and the actual outcomes are educational outcomes, subsequent employment outcomes, how's their well-being outcomes. So we use a clumsy interim proxy measure, data measure, but we are now tracking that cohort in terms of making sure the ultimate outcomes are achieved. So On Track, very, very similar. We use a clumsy reoffending rate in terms of understanding the efficacy of the program, but actually what we want is the well-being of that individual. So yes, we want to reduce reoffending, but actually it's the flow-on benefits to the community, the flow-on benefits to that individual, to that individual's family, children, etc. So the On Track program ran for a few years. We kicked it off in 2016, 2017. And the really interesting point for me on here, and our colleagues in Boxar did the data reporting and looking at how the intervention group compared to the control group. And this was a program which we were really pleased after 12 months, after 18 months. Our colleagues on the corrective side were really pleased with how well it was working. The service delivery crowd, Axio, were equally pleased. The parolees were we did surveys, were very encouraging on how the program was operating. Then we got the data from Boxar, and it actually didn't suggest it was working so well. And actually there was no statistically significant difference between the reoffending rates of the intervention group and the reoffending rates of the control group. So firstly, everyone was quite surprised because anecdotally we'd been really pleased how it was operating. So we really interrogated the data, and we really interrogated the data in terms of, you know, were we using too simple a measurement? Because as I said, human beings are complex, outcomes are complex. We weren't just interested in a reoffending rate. So for example, the types of offences that were being committed, the time to reoffence, and then we were looking at some of the other aspects in terms of, so whilst the reoffending rate may not have been statistically different, were there other aspects in the individual's life that had been better off? So we pored over the data and did some quite intensive investigations of, you know, what was happening to that cohort. We actually still didn't find a statistically significant difference. So the program continued into a second year. And again, we went through that, the same process, because after the second year, when we hoped, and a lot of our experience of when services are set up, it takes a year or two before they really get bedded down. So then after the second year, again, we pored over the data, again, didn't find anything statistically significant between the intervention group and the control group. Now, the power, I think there's a few things I would draw out here. The power of the data here was that anecdotally and in terms of gut feel, and indeed even the headline data, so the headline rates of reoffending were coming down for this cohort. The challenge was it was actually coming down across the board. And unless we had done that intervention group control group, we wouldn't have been aware of it. So the point of this case study is in the absence of having that rigorous data assessment, we would not have asked the question, how effective was this program? Because we would have just carried on, because all the indicators and all the feedback was it was going really, really well. Now, one of the questions that fascinates me on this case study is to understand why it hasn't been as effective as we expect. Oh, and by the way, I should say that we, by mutual agreement, we stopped the program after 2 years, which for anyone who's spent a lot of time in social services, when we set up these intervention programs, it's actually pretty rare to get a mutual agreement across the commissioning agent, our correctives, plus the service provider to say, we actually need to stop this program. So one of the questions is, and this is why this was such a powerful experience for me, was to actually try to understand why is it that a post-release program where we provide intensive support to parolees actually has no impact. And this is something we're still working through now to understand. But one of the questions was whether by providing such intensive support to parolees, we are actually disempowering them. We're actually stopping individuals from making decisions about what they want to do. So we were arranging accommodation, we were arranging job interviews. And actually what we were doing, whilst very well intentioned, actually wasn't doing them any favors. And so, for example, job interviews for jobs they actually weren't passionate about, as an example. So again, what the data has helped us do is firstly understand and ask the questions about the efficacy of the program, and then really try and understand the why. And I think that's really powerful. Now I'm conscious of time. So my last case study of how data can be so useful in such an uncertain environment is where we are at the moment in terms of our COVID-19 experience. And I won't talk through this in too much detail, it's not that complex, but it's more to say, if you think about some of the, and they're not necessarily trade-offs, but some of the questions that, premiers, cabinets are being asked to look at in this context of, you've got a health risk here, and let's be clear, the health impacts, if you look at the mortality rates internationally, but also the impacts on health systems. There's a huge health risk going on with COVID-19. So obviously, the world over, we're seeing restrictions being imposed. But those restrictions have themselves a huge impact in terms of the economic impact, but also the well-being impact. So this is an example, and those are complex issues. And, as I said, making those trade-offs, understanding when restrictions should be imposed, eased. And what we've done here, and this has been definitely a whole of government approach, was try to provide decision makers with a framework to help inform those decisions. So what we looked at was what has been the economic impact, looking at what's been happening with jobs, which sectors have been particularly impacted. Obviously tourism, retail, hugely impacted. We then looked at an overlay and a framework of well-being. So how is this impacting on individuals, families, communities? That was based both on pre-existing understanding and subjective well-being surveys of well-being, but also surveys of the New South Wales residents to understand how they felt about the imposition of restrictions. So, so as an example of why that was so powerful, one of the first restrictions to be eased was increasing the number of people that could go to each other's households. Because one of the overwhelming bits of feedback when we surveyed residents was what were the things that were really struggling with, and it was those interaction with close family and friends. And then the final one from our health colleagues was, you know, what are the risk aspects of the restrictions? You know, if you lift the restrictions, what are the potential risks? So this is a framework, but there was actually, and I think it's one of the real lessons and successes of the cross-government collaboration, and I mean that at the state as well as federal level, is the sharing of data, and the sharing of data across economic, health, well-being, social impacts has been extraordinarily powerful. I'm out of time now, but you know, there's some real powerful data behind each of those indicators that are being used to inform decision makers. So why have I talked through those case studies? And you know, as I said at the beginning, social sector is complex. I've worked in the commercial sector where there's something very beautiful and simple about driving financial returns because it is so simple. Human beings are much more complex, and we need to recognize that complexity, and it's why often the social sector is so much more difficult to understand effectiveness. And what data helps us do is, one, helps us really ask those questions on, are we being effective? And driving improved effectiveness. If I think about the NEWPIN example, by providing, and these were the centre, the caseworkers with the data on what was happening to the families 12, 24 months after they left the centre, they were really, really keen to push the envelope of how we can support more families affect those restorations. So again, it was great in terms of helping frontline caseworkers understand not the impact of the families as they leave the next day, but 2 years later. On the on-track example, it was understanding and asking the right questions about why things were working or in fact not working, and challenging those gut feelings where everyone, myself included, thought this was a super successful program. But the data helped us challenge ourselves. Was it actually as effective as we thought? And then finally, the COVID-19 example, you know, we are in and as we see the world over, this is a complex environment. If you look at the decisions that are being made in the US and the UK at the moment, the last two places I lived before moving to Australia, there's some really tough questions as to how, when you lift restrictions and what the consequences are in terms of those health and infection rate impacts. We created a framework here, not to make decisions, but to help decision makers ask the right questions across those dimensions of economic health, economic impact, well-being impact, but also those health risks. So that's it. As I say, this for me, those case studies are not about, data doesn't give us the answer, but it really, really, really helps us ask the right questions. And that was all I wanted to talk through. Happy to cover some questions off later.